And just like Michael Jordan, 23 is the best, this episode will be the best. Or it'll be more like Michael Jordan as a general manager, which is kind of a complete shit show. Either way,
Oh yeah, I watched that the first two episodes of that Netflix documentary, The Last Dance.
that's cute. You call it a Netflix documentary.
Netflix
No,
what was that?
it was on ESPN. There was 5 weeks, 2 episodes a week. You
You
missed
son of
it.
a
You
bitch.
missed it when it was hot. And that was an awesome ass documentary, though. I watched the shit out of that. That's what I was watching when I was charting. I spent weeks charting. I'd replay an episode just because I had a huge crush on Michael Jordan. I have 5 pairs of Jordans in my eyesight right now.
Wait, shoes?
Yeah,
Dang.
2 pairs
That's
of
fancy,
11s.
right?
Yeah, they're nice. 2 pairs of 11s, pair of 13s, some Jordan trainers. Can't see. I can only see the lip of the fifth pair. And then I'm trying to get a pair of Jordan golf shoes because they look like the shoes he wore when he won in the finals, or that he wore in Space Jam. I want those shoes as a pair of golf shoes. But I
What
was
about
looking.
his cleats, his baseball cleats?
Uh, I don't need a pair of those because it, look, it wasn't that good. So I realized trying to find those shoes, they are $595.
Good God.
I'm
I have like
somewhat.
two pairs of shoes, or three. One's slippers, and then the other one's flip flops, and the other one is Crocs, but they don't look like Crocs.
If they're Crocs, they're Crocs. So I am a sneakerhead. Me and Nicole both. Well, they don't look like Crocs. You're right. They do look like Grandpa slippers.
I'll take it.
What's the most you ever paid for a pair of shoes?
I think it was some Skechers shape ups. I think they're like $100. And I know you can laugh, but first off, number one, comfiest, the most comfiest shoe I've ever worn. Number two, they give you like this much height, and for a person of my height, that's awesome.
Uh, I can get the height. I can get behind the height aspect of it. I'm talking about like the most expensive pair that you wear, or like, or have ever bought. They don't
Yeah,
even touch.
that's
I'm
those. Yeah.
I'm just a sneakerhead, so the most I've ever spent on a pair of shoes was $397.
God, I don't even spend that much on a monitor, and I
That
use it like 8 hours a day.
it was during the height of some Michael Jordan comeback stuff, and I ordered them. What makes it worse? Never even got the shoes. Ordered them on
What?
eBay. I sent a cashier's check. Guy deleted his account, and I never got the shoes. It was right before I moved to Florida.
Oh man, feels bad. That's
It
terrible.
hurt so much. I was so fucking sad.
That's probably the worst thing I've ever heard happen to somebody.
Worse than my worst first date, where my car got stolen.
Yeah.
Luck is not always on my side, my friend.
So, what are we going to talk about on today's episode of On Call Pod?
Well, I've been on call for the past week, and I feel so fucking happy to not be on call. I'm gonna do some medical shit with you today, my friend. Because why not? You you'll learn some things. You look a little comfortable tonight. You look a little sleepy, but it's Eastern time, so it's late for you.
Just need to do a line of some Adderall.
That'd get you. That would get you. The first we will do. It's a little less exciting, but they are the most famous medical malpractice cases. Some would say they are the dirty dozen of medical malpractice. So, you're not in healthcare. What is something that you would think would be something for malpractice? Like what would happen that you would be like, oh shit, they fucked up?
Okay, definitely. Okay, definitely. Yes. Okay, removing the wrong organ. So, like, if you're it's a lung or a kidney or something, removing the wrong one, or sewing you back up with like a tool left inside you, or removing the wrong like arm or something.
I mean, that really hits on a lot of spots. So
Yeah.
I have actually had patients that have had the wrong side operated on. Never an amputation, or like they took out the left kidney and they were supposed to take out the right. But I have had a patient who needed his right knee operated on, and they operated on his left knee.
Did they make the left knee better at least?
Well, I mean, in time it would have been, but because he needed the other one worked on, they had to end up doing both knees within 24 hours, and he didn't have to pay for his hospital stay.
No, that's good.
Naturally, right? That's how you prevent a That's how you prevent a lawsuit if you can. I don't know if there's I don't know if there's other stuff involved, but he didn't have to pay for that his stay, and he got the VIP treatment.
Yeah, I'd want some free service after that.
So surprisingly, like it's listed on this website. I really don't need to give a name or even a site because it happens all the fucking time. Wrong amputations. I've had patients that have had the wrong toe amputated.
Really? Like how does that happen? Like
Uh,
they write it down wrong or what?
Usually, yeah, the person that assesses to treat the patient, they won't identify exactly which toe correctly. So
And you can't tell because like the stuff's happening on the inside.
yeah, because like medically, you're supposed to say it's not like third, fourth toe. You're supposed to say it based on how you look at the patient, how instead of how you look at him. So like if I'm looking at you, your right arm to me is your left arm. So the person assessing that patient will say, "Oh, right fourth toe," which would be the toe next to your pinky toe on your right foot. But if I'm looking at you and I say that, that would be your left fourth toe. Bam. Wrong toe, wrong foot.
Yeah, they need like a separate company that comes in and marks it before surgery so they can sue that company and that company has excellent insurance.
That's what malpractice insurance is for. It happens all the time. I have seen, I can't believe it. So now, pre op, they'll go in with a giant blue Sharpie and they will mark both sides. Yes, no.
Yeah,
All
that's
the
what I would
time.
do.
Yeah. And I mean, if especially when you have a patient that has an outpatient surgery, they'll come in at 10 a.m. They'll write you on a Sharpie, and by 10:45, they're cutting you open. So there's not a whole lot of let's fuck around and do this shit. So, I mean, it's super common. That's why it's like, to call it one of the one of the biggest things for malpractice, not fair. There's a lot of people that are assessing patients that barely have a high school education.
Yeah, and I'm assuming you assess like a crap ton of patients every once in a while. You're just like brain messes up type of thing. That's why they need a
Usually, yeah,
backup. But so what's the malpractice case you're talking about?
the malpractice one was a 52-year-old Willie King. He was supposed to have his diseased leg amputated in 1985. And the surgeon took the wrong leg.
Wow, and he couldn't tell from looking at the legs it was the wrong one.
If you don't have an open wound, it's incredibly hard.
Okay, I
But
figured
it's
the
not
leg would
his
be
fault.
amputated. It would at least look like shit or something.
The biggest cause in his case was the staff, because in an OR, there's generally 7 to 10 people in the room with you. They draped and sterilized the wrong leg.
So
A,
they didn't even look at the other leg to
a
have a good
surgeon,
reference.
they just looked at a chart and they draped the wrong leg. The surgeon, he doesn't even look at the chart generally. He assesses the patient days before, makes a plan, and then comes in a couple days later to actually do the surgery. The surgeon who's making all the money generally spends the least amount of time with the patient.
Okay, this is his foot. Oh, somebody analyzed it.
Uh,
I'm looking at the analysis map.
the doctor's defense later was that both legs were unhealthy and would have been amputated. He was fined
Yeah, the
10
other one
grand.
needed to be amputated too. That's his argument.
I mean, the guy actually ended up with $1.1 million. So, we discussed that. What would it cost?
Because he had to get his other leg amputated too.
Yeah.
So now he's got no legs. He can't even hop. It's bullshit.
You can, if he's not diabetic, he could be Blades like, what's his name that was in the Olympics, the Special Olympics. They call him Blade Runner.
Oh, it was just a foot. Yeah, yeah. It wasn't his whole. It wasn't his whole leg. So
Oscar Pistoria. He could be that guy.
he had no feet.
He had no legs from above the knee.
Was it Special Olympics?
Yeah, it was.
Oh, okay. I was gonna say. I was like, dang.
Yeah, he was like the gold. He was the guy. He's the Michael Phelps of the Special Olympics. That's a
Damn.
big deal. Now this like the biggest thing for me, like it's number one on the list, and it was a failure to obtain a blood type. I have never seen this. I have never witnessed this. Thank God, because it is not a pretty sight. I've heard of cases of it happening. I've given blood to probably 40 or 50 different patients. You always double check blood. Always double check, because if you thought it was bad when you got a bee sting and you went into anaphylaxis and you needed a shot of epinephrine, if you start getting the wrong blood type, your entire body immediately starts to attack it. And
Yeah, I don't even know what my blood type is.
you should just go and donate 1 unit of blood so they can tell you what it is. Because it can
I'll
save
take
your
1
life
unit
in the
of
long
blood.
run.
Sorry.
Like if you get hurt and you don't know your blood type, and you're in
I
a
was like,
diet,
I think it's like AB.
yeah, you probably not. You're
But they
probably
can't
O
just. Oh yeah,
positive.
you're right. I should.
You're probably O
So is there
positive.
somewhere? Can I just go get my blood type tested?
Not that I know of. I only know mine because I give blood every 6 weeks.
So I should go give blood, and then they'll tell me.
Yes, because they have to type and cross it, the blood type, and they
Okay.
cross match it to make sure that you have RH positive or negative blood.
I've known at some point, and I feel like it's AB something.
Then if you're AB negative, you're the universal donor. You can give to literally anybody on the planet.
Oh, I thought it was O.
O is a universal recipient. You can take any blood. U would be the unicorn, who can give any blood.
I don't know. That doesn't sound like me.
I always mix it up, but O pos is the universal. See, now you're making me question it. We might be the universal recipient, not the universal donor.
I thought O was yeah.
We're the most common type.
Type universal donor. All right,
O negative.
Universal donors are those with an O negative blood type.
Yeah, universal donor. I'm O positive, so I'm not the universal. I'm RH positive, which is just an autoimmune response, which causes an attack on the entire system.
So that guy got $1 million for his foot.
It doesn't talk about what he got. He got a lot. He got a really bad outcome. If you don't double check everything, there's things in medical professions you just kind of rush through a lot of things. Blood's not one of them.
Oh wait, this is the blood type one, not
Right.
the foot one.
You cross match, you double check, you take another nurse in with you before you even start to administer it, and you go birth date, name, wristband. There's 5 different things that you check before you give the blood.
and then you ask, who are you voting for in the next election?
If you
To
have to,
decide if you're going to
if you
give the
have
right
to,
blood.
if they told the nurse before that that's what they did, you're gonna make sure that that's what he said before. It's really, I've only seen stories of it happening before, but it happens. This guy in this story, he got it. He was left with severe brain damage, and it destroyed his organs, specifically the kidneys and the liver, because those are the main two filters for blood. Sadly, in this case, the hospital covered up the mistake. Now, I know we don't talk a lot about healthcare in this show, even though it's the on-call pod. Get your fucking blood checked. Find out what type you are, because it's super important.
Get it tattooed on your chest.
Yeah, I mean, if you want to, you can get a fancy ass silver bracelet if you want. But if you get into a
Yeah, I
car
mean, that'd be a
accident,
cool tattoo to get, right? The
AB
blood
pause.
type.
AB
Yeah.
pause. That's right.
And it's practical too.
If nothing else, it's to save your life. If you're losing blood at a rapid rate, you knowing what type you are will save your life. Because it'll give you 45 minutes time saved versus when they type and cross you.
I knew a girl who got Braille tattooed on her arm that said breathe. And I was like, doesn't that defeat the purpose of Braille? Like, you can't touch it. But, yeah, apparently, no. I'm the asshole for questioning it. She wasn't deaf either. She was just a regular person who thought it was cool.
Good for Braille.
Yeah, and I
Free
want to
Braille.
hear from our listener if they think that getting a Braille tattoo of a word is cool, or if it's weird, like I thought.
I can't imagine someone's gonna be like, "Holy shit, that's fucking awesome." I don't see.
It defeats the whole purpose to me. It's not, yeah, whatever.
You know, if you listen to this show, and you like the idea, don't listen to this show. I know we're not in a spot to turn away listeners.
Wait, I might be the asshole though. You never know. It could just be me who's the asshole.
I don't think you're
Like
the asshole.
the person could be like, "Don't tell me what to get tattooed on my body. I'll tattoo whatever the fuck I want."
Maybe
That
so.
could be totally
Not
legit.
not this time. Excuse me.
Woo!
We talked about the wrong limb. The other thing is surgery on the wrong side of the head. That doesn't really happen either because you prep the field. So biggest malpractice cases was 3 mistakes on the same day on 3 different patients because they set up burr holes on these 3 patients to be drilled to relieve pressure. Say you get into a car accident and you hit your head. All right. Then you get a concussion. Well, concussion is caused by your brain hitting your skull. When your skull hits your brain, you develop a bruise. On your arm, not a big deal. Soft tissue. On your skull, your brain can only swell so much before you're turning yourself into...
It explodes.
In a manner of speaking, because you can block off the flow back down your brainstem. Not ideal. In this case, happened in the same hospital. 3 people got messed up. All 3 patients got mixed up. 2 of the 3 were caught in time. The other one, not in time, which led to the wrong side of the head being drilled than the side that the blockage was on. A dead 86-year-old guy, just from someone mixing up a CT scan. Shouldn't happen. Can happen, especially in emergent situations. So I do feel bad for that guy.
Well, I feel bad for that especially if he died. But like, what about somebody who the wrong testicle was removed and then they had to get the other one removed too, so now they got no testicles?
I mean, if you're fertile and you don't have kids yet and your dream's to be a parent, that's pretty fucking devastating. Like, you don't have kids, say you want kids.
Even if you have both testicles right now, go, jerk off in a cup and put it in your freezer. Just in case.
Generally not in a regular freezer because it doesn't get cold enough to store the live cells in the sperm.
Oh shit! So the ones that I have under my bed aren't okay.
Just turn those into smoothies.
Gross.
Listen, I have read many a story lately of the women that are storing sperm for their
Tying off a
smoothies.
condom and putting it above their bed like a trophy.
There's a woman, I mean, I swear, I have had the story sent to me 3 or 4 times of a vegan who's drinking the smoothies. Well, technically, it's not really vegan because it's a protein source from an animal. Dude, yes, but it's still an animal.
I have nipples, Greg.
Would you
Can you
milk
milk
me?
me?
Fair enough. See, then we did the wrong leg. Oh, wrong sperm. Number 5, wrong sperm used at a fertility clinic. Baby
Wait, oh
born of
god, I thought it
different
was to
race.
like impregnate this guy's wife, and they used the wrong sperm.
Ooh. I don't. What would you do? Say you are a happy couple. You guys are ready to roll. Turns out, dad's seed. He, like number 4, got the wrong testicle removed from his testicular cancer. Pulled out the good one, then had to go back and pull out the bad one. He didn't come into a cup. He meets the love of his life. Want a baby. He's already infertile. All right, we'll go to a sperm bank. We'll line ourselves up with a magical doctor. And we're going to have our beautiful blonde-haired baby boy. Well,
And he comes out and he's got brown hair. And you're like, what the fuck?
and
This
brown
guy's got a
skin.
history of diabetes.
It's fucking crazy because it's so expensive to use a fertility clinic. You're looking at least like 50 grand just to go through
Well,
everything.
I'd like my money refunded, number 1.
Yeah, but say
That's
you
about it.
you set everything up. You have yourself your doctor, this doctor donor. Everything's lined up, and then all of a sudden you have a black baby. It's nothing matches the application.
Wait. Oh, so it's like a personal contributor. Like you know the person, or it's just like you're already picking someone different. Because I mean, I feel like maybe to me picking it's just a different person than I picked. That may be worth like the free 50 grand. But I don't know. Yeah, I don't know. I'm not a kids guy, so it's hard to tell. But if I had like somebody like, oh, it's my friend, and he's fucking 6'5" and chiseled and smart as fuck, and then you just gave me like some fat guy's sperm, I'd be like kind of upset.
And what if it's a different race? Like, say even if you're a black couple, a successful, happy black couple that spends all that money, and then you have a white baby. I can't imagine raising a child of another race when I'm ill prepared for it.
I mean,
It seems really difficult.
I don't really. I don't know. I have not gone through that, so I can't really comment.
I mean, neither have I. My kid is white. I'm white. It's a very easy explanation.
But it's like if you're getting another person's sperm anyway, I mean, like, what matter? Who cares what
you're
race
picking?
It is?
You're picking that race though, to avoid these questions because maybe you.
What are you goddamn racist? Come on, it should be any color.
No, I'm someone who has expectations through a company that I'm paying money to give me the service I provide. Like, give me what I want.
What's it worth though? Like money.
Oh man, I don't know because what do you do if it comes out completely different than what you expect? I'm looking at $1 million easy, free college.
Yeah. Okay. College. Yeah. I'm thinking the fee is refunded and free college. Boom. That way you can still take care of the kid because it's not like you're gonna not take care of the kid. I mean, come on.
We live in a pretty closed-minded society these days. Are you not?
Well, fuck those people.
Number 6, wrong organ removed.
Okay. He was getting his kidney removed and they accidentally removed his dick.
Well, no. And this one they removed his gallbladder. Have her gallbladder removed. They took out the right kidney. Man, that's hard to fuck up. That's hard to fuck up. You're supposed to get your gallbladder and they took out a kidney. That is not the same thing. They're on
a marker on the gallbladder.
I mean, they probably didn't, but the organs are kind of like one's in the front, one's in the back. You had to pass the shitty organ to get to the good one. and then still took it out. I don't know. I mean, I can see why he got placed on fucking 5 years probation. Yeah, because he doesn't know.
Surgeon?
Yeah, he doesn't know the difference between a good organ and a bad organ. They don't take gallbladders out for no reason, even though it's an easy surgery.
Wasn't there one surgeon who like didn't know what the fuck he was doing and like killed like a shitload of people and is in prison right now? I can't remember.
I mean, there's quite a few of those actually. It's I feel I've heard of a few. I don't have names for you, but they practice and they. If you get it right with the people training you, you can pretend to be good at your job. Um, Number 7, tumor removed, instrument left. Super common. It happens so fucking often where you go to take an organ out and stuff gets left behind. There's supposed to be a specific scrub nurse that's meant to count what goes in so you count what goes out.
Because sometimes you have to leave stuff in there, like something that holds something or something, because it's not like you drop some fucking pliers in there. It's like this holds this while we're working, and then we forgot about it because it's hidden.
The amount of forceps you have to use to cut off blood supply to certain areas is crazy. There's a lot. There's a lot of metal instrumentation that are meant to hook and lay on the walls of everything that you're working on, of your surgical field. Those aren't typically what get left. Usually, what gets left is fucking gauze, sponges, parts that you're grabbing in the heat and patting them dry to get a clear visual field. When you suction's not enough, then you're getting left shit behind. Now in this story, in 2000, Donald Church he went to University of Washington and Seattle. He was supposed to have a tumor removed. They did take out the tumor, but then they left a 13-inch medical retractor. How you forget a retractor is beyond me. They're fucking huge. It's over a foot long, and it's meant to spread things.
Just like, okay, I won't say that.
And it's a metal retractor, so all it would take is one X-ray to see it. It would show up because it's not hollow.
Right now. Yeah, it's pretty big.
I don't know how that happens. I can see a sponge, some gauze. Retractors should never happen. They're big.
God.
Yeah. So.
Did it fall like, when you're like working on an engine and it drops and it goes down in there and you need like one of those like magnet things?
Who doesn't use the magnet to run it through to make sure you didn't drop a screw into the block, right? All right, number 8. Patient wide awake during surgery.
Ooh, now you're talking about nightmare shit.
It's actually the topic of one of the movies that I am afraid of getting my gallbladder taken out.
That Hayden Christensen.
That's right, Awake
movie.
Oh, nightmares. That is nightmare fuel to me. Granted, his is a little more extreme because it's a murder plot to make sure the rich kid.
Oh right, yeah, I didn't watch that one. I just saw the premise of it and I was like, no, thank you.
I'm afraid that they're going to put me under general and I'm not going to fall asleep and I'm going to feel everything as they slice me open. Oh. In 2006, Sherman Sizemore underwent surgery. The paralytic, properly administered, worked just fine. The second, unfortunately, wasn't. He was wide awake and could feel everything.
Wait, he could feel it?
Oh, a paralytic literally just stops your muscles from being able to move.
Well, why didn't they like cut off his nerves and shit? Like, not.
I mean, that's generally what the anesthesia is supposed to do because it's putting you out deep. And then if you get a local instead of a general anesthesia, it's meant to kill all the nerves in that specific area.
Like when you get a vasectomy.
Yeah, a couple of shots of lidocaine.
To do.
If you get it
very soon.
If you get a like an infected toenail, you get an ingrown toenail, you'll get like 4 or 5 shots of local anesthesia to the area, which is usually just lidocaine and then a big rubber ball to keep all that lidocaine in one specific spot while they dig into you and pour acid on your busted ass nail.
Ugh.
So 16 minutes into surgery, they realize he's fucking awake. Half an hour of conscious, painful surgery by the time they were able to fucking get him under control.
Dude, that's PTSD shit. I'd be asking
Right
for
out,
quite a bit.
oh, fucking nightmare fuel. So, other than that,
God, my next surgery, I'm just gonna be like, I was awake the whole time. Ah, you owe me money.
and oddly, he couldn't remember anything. They put him under after that half hour, and he didn't remember anything from the surgery.
They wiped his memory, dude, with that Men in Black stuff.
Oddly, further on down the road, they realized he was having panic attacks from thinking that they were going to bury him alive. Had nothing to do with the surgery. Psychologically, that took over, like a secondary effect.
Might have had something to do with the surgery.
Sadly, a few weeks after the surgery, he killed himself.
Oh, man, he didn't even get paid?
No.
Oh.
He also had a thing, which is what my fear is anesthesia awareness. So even when you're getting the anesthesia and everything, doesn't matter. Your body processes general anesthesia differently, and it doesn't work in you the same, and you stay awake. It just doesn't turn off that part of the brain.
Yeah, so don't take anesthesia recreationally because you'll build up a tolerance to it.
My dog has to get super high doses of anesthesia in order to remain asleep because her metabolism is so fast. It's called the Greyhound Protocol.
Ah, interesting. Yeah, I have to get my dog put under to get teeth cleaned.
No. Oh, Ender?
Yeah. Well, I mean, that's common. That's pretty standard, I imagine. Well, actually, yeah. No, I can't even brush her teeth, so. Ender, come.
You have I use the gel. The gel, so they constantly lick really hard to try to get the gel
I
off.
don't think that gets the scrubbing action you really need in there.
It's true. I went lazy.
Yeah, well, I can't get near her teeth or toenails. Thankfully, they don't grow that long. I don't know what the deal is with her. Thank God.
Do you walk Edna outside?
Yeah, but even if I don't, her nails don't grow. Like her dew claw doesn't grow long, her nails don't grow long. Even if I don't walk her outside, I don't know what the deal is.
I have to use a fucking grinder.
Nature or some shit.
Yeah, I have to use a grinder because Arya doesn't like her toenails touched.
Yeah. I would have to literally put Ender under to cut her nails.
Woo! All right, we'll move on. We're over time. We're gonna go to a little different, a little more fun, rather than individual cases of depressing shit like homeboy killing himself.
Can I get a beer first?
Yeah, absolutely. So people can watch this video, but it's going to be something that I'm going to edit out on the audio portion of the podcast, the 33-minute mark. Ooh. So for those who listened early on, me and Lowell discussed our favorite shows. That show being The Office. It's fucking phenomenal. Can't get enough of it. Love the show so much. Well, for those who love Stan, Leslie David Baker, who's the actor who was in the show, has launched a Kickstarter. Granted, he did it nearly a month ago. Didn't have the chance to put this in the show. He is trying to launch a Kickstarter for a show. The specificity of the network hasn't been described. He's doing it for himself because he wants to have his own show called Uncle Stan, which is meant to portray his life outside of life at the office. Yeah, I'd probably watch it. Because why not? I'm a big fan of The Office. Really got into Big Bang Theory because it's a show that I don't have to pay attention to. And then, there's Lowell here who's using his squeaky toy.
Ender, come. You're talking about The Office?
Yes, Uncle Stan.
Ender, come. All right, she's not interested. I won't squeak it.
So the people watching on YouTube will see you squeaking a toy. But I did my little story on Uncle Stan. So Stanley from The Office has launched a Kickstarter to get a new show.
That sounds like a terrible, terrible idea. Stanley cannot carry a show by himself.
It's probably going to be a shit show, but
it'll never happen. If the Dwight Schrute spinoff couldn't happen, and Dwight Schrute was like 40% of that show, then there's no way a Stanley show is going to happen. Stanley the Manly.
Yeah, I mean, that's probably true. Because the last 2 years plus, Dwight carried that fucking show.
Oh, yeah. Yeah, because they ruined Andy's character.
Oh my god, he turned into such a schmuck with the sailing and everything. Let's see. So, cooler things that you might not have heard of, Mr. Lowell.
Lowell?
10 of the most bizarre medical practices and theories. A lot of these I already knew just because a lot of psychopaths try to still use them now, or anti-vaxxers, or whoever that may be. One of them is one that was number 10, urine therapy. Not sure how familiar you are with it, but it actually
No, I saw this on Pornhub just about an hour ago.
That long? I guess so. 37 minutes in. Could have been.
An hour before we started talking.
The use of urine has been used for a super long time, and has gained traction again.
I know I didn't think it was cool at first. Now it's a little bit hot.
Like urine, fresh young boy urine in China specifically, which this doesn't quite delve into it as much. There are people that get paid to go and collect urine from preschoolers and kindergartners in China to pee in the cup and then use it to let people to rub on their faces for a youthful appearance to avoid crow's feet and bags under their eyes.
I heard if you get semen straight from the source on your face, it has the same effect.
Nicole! It doesn't work. It's just urine. It's just filtered shit through your body. It's not anything that's going to make you
sterile,
sterile for a minute. As soon as it hits your urethra, it's not sterile anymore.
As soon as it hits your what?
When it's going out your urethra, it's not sterile anymore. It's sterile when it's in your bladder.
That doesn't sound right. I've seen some videos where
they say it's sterile until it leaves your body. Your pee hole is dirty.
My pee hole is not dirty. It's the cleanest part of my body.
Did you just spritz some sanitizer on it? Because I don't think your pee hole's clean.
Whoa, urine is not sterile. Even before it comes out of you and gets contaminated by your skin.
Look at that.
Well,
you're welcome.
Porn is lying to me.
I didn't say it didn't feel good to get peed on. I said it's not sterile.
So you should drink it if you find yourself in a waterless pinch. But it is not sterile.
It's not good the second time around because...
It's pretty sterile, though. I'll take that because,
it's clean. Look, it's not sterile.
My hand's not sterile. See? Like, I'm fine.
That's how you get MRSA.
This beer is not sterile.
You're right.
Vape's not sterile. People's buttholes aren't sterile. And, well, anyway.
Another story, another day. The next, children's soothing syrups. There's been a lot of those over the years, including like the rubbing of bourbon and everything on your kids' gums.
Yeah, I'm familiar with that one for like a toothache or something.
Yeah. They used to use a lot worse stuff than bourbon. That the morphine huge back in the day. Not good for a
Yeah,
baby.
yeah, we've had opiates for a long time, right? They would call it the poppy milk or something, and they would give it to
Yeah,
like Roman soldiers so they could march all day.
yeah, milk of the poppy.
Dude,
Yep.
poppy. I remember I made a video on YouTube like way back when YouTube was first starting about how to make poppy seed tea. So for you like opiate addicts, it would like you would like wash the poppy seeds you would get from the grocery store to like try and get some of the
The residue.
stuff off of them. Yeah, and it got like 30,000 views in like a month, and I was like, you know what? Actually, I'm gonna take this off. I don't know. This is the greatest thing to be posted.
Well, it would. If you could, if you could get away with it, why not? Fuck it. They did way worse back in the day. People would just put whatever drug they could find to help calm the kid, like a tea bag, whether it's morphine, heroin, cannabis, powdered opium.
Well, cannabis. I mean,
It
come
would
on, that's
calm the
probably pretty
kid.
good.
But a lot of times back then, you'd wind up dead.
I actually consumed some cannabis last night, and
In what form?
uh, like the vape oil things.
Just like a vape. Okay, all right, I got you.
But yeah, I feel like ever since I stopped smoking so much, it just makes me like sleep in really late.
I
It's good
had
sleep though.
I had a friend who would do the dabs, so like he'd have that giant ass water bottle and just a hot ass dab, and
Yeah, the last time well, I've only done that once, but oh my goodness, that's the last time that I can remember being like too high was from doing a dab. It's just way too concentrated. Don't do a dab, people, unless you're used to it. It will couch lock you. You can't move. You'll get paranoid, the paranoia. And for people who are getting paranoid from just anytime they smoke weed, because I've talked to people about this, just smoke a little bit of weed, not a lot. If they're passing around a joint, don't take 3 or 4 hits. Take like a half of one hit. Wait 10 minutes. See how you feel. If you didn't do anything, then do a little bit more.
that's fair. The guy that I did my internet show with, he would do a dab to start the show. 40 minutes
Yeah,
in,
he
gone.
tolerance is through the roof, man. I don't understand being able to like smoke weed and then
I don't.
be on camera or on mic or anything like that.
He was.
I'm
I
just so
mean,
stupid.
if Eric's listening, your dabs ended up being a downfall, my friend. So beyond that, next, mercury. Mercury is fucking toxic. There's a reason they
Really?
don't even put it in thermometers anymore.
Isn't it in fish? Is there mercury in fish?
Yeah, because of all the shit that we've put into the water.
Really?
Mercury
So I
poisoning?
shouldn't be eating like just pounding sashimi anymore.
No, probably not. Depends on how often. If it's daily, no.
Yeah, pretty much don't eat it very much.
And the deeper the fish lives, the worse the mercury poisoning is because it's denser than water, so it goes down. So if you're eating fish that bottom feeders, they're less
Well, how are we dropping mercury in water? How's that happening?
waste. Waste from everything. Mercury was
Ah,
everywhere
okay.
before. It was in. You can just buy it in a glass vial and give it to your kid if they had a fever.
A little shot of mercury.
It used to be in a little eye dropper, and you put it under the tongue, a dab under the tongue.
Mm-hmm.
I
Oh,
actually,
sublingually.
I actually had a patient who had gone catatonic. Like her permanent at rest was all of her muscles, upper and like all of her thigh, her calf, biceps, forearm, constantly flexed. Couldn't relax.
Yeah,
Had twitches all the time because her husband
I'm never flexed. It's not
her,
flex. It's just
her husband
control.
was a chemist for the government, and he used to
Ooh.
poison her with it.
Oh yeah, that's like S Town, right? They thought what was his name? John B had
That was
mercury poisoning, I think, right?
that was a good, yeah, but it's because he did it, and he did it with his watches and everything too, right? And he had this,
Oh right.
so just like radium, I think it is. Eventually, you just eat your brain away by messing with that sort of stuff. But yes, John B.
Oh,
S Town was a good series.
John B. Yeah, anytime anyone says a podcast or if they say your podcast isn't good, say, well, yeah, S Town had bad reviews, and that's like the greatest podcast ever. So
I can't believe we never talked about that.
S Town.
Oh well, yeah, we talk about podcasts. We talk all the time. We didn't. S Town never came up. I listened to that whole series as it came out. That
Oh,
and
nice. Yeah.
uh what's his name? Adnan.
Yeah, I don't
The
listen to that other
serial.
podcast, but I did listen to Serial. Yes, the first season. Adnan,
I didn't listen
guilty
to.
as fuck.
Yeah, season two I didn't really get behind, but season one I listened to it a few times to try to listen to it. It was making a murderer for a podcast. That's like
Yeah, as in it made him seem like he wasn't guilty, but he really was.
as new stuff come out. I haven't even followed enough to know.
No, but I'm just telling you based on my opinion that Adnan was extremely guilty. No one else had a motive except him, and he was the only person that couldn't remember anything. Conveniently,
No,
in the very beginning of the podcast, they started out with, what could you remember from, like, years ago? Like they make it seem like it's possible that he was not guilty and it was Jay or that other guy, but no, it was Adnan. He was the only person with motive. That's why motive matters.
fair enough. I'll give you that. Excuse me. Uh, moving on. Heroin for costs. That was super common, and I had a patient that had that. There was a glass bottle that it came in. They still had
Heroin
it
for what?
for a cough because
Oh, okay.
it's a vasoconstrictor. So, it, I mean, it really could work for a cough, in the same effect that caffeine would work for a cough.
You ever done heroin though?
Now I've never been banging out heroin or nothing.
You ever done like an opiate though, like a Vicodin, Percocet?
Yeah, I've had a couple of Vicodin when I first herniated my back when I was 22.
Mm-hmm.
It numbs you. I don't like the idea of that. I'm an upper kind of person. Despite my
Yeah,
love for alcohol,
yeah,
I like how alcohol makes me feel early on. I don't like being hammered because then it's really a downer.
yeah.
I don't understand the love of nothingness. It's
Well, the opiates, they make you happy too. That's where the upper downer thing is sort of a,
misnomer.
yeah, exactly. Because when you take opiates that are technically a downer, I mean, they make you happy. So, um, yeah, I don't know.
So the big thing why heroin used was so much is heroin was used to treat morphine addiction. Unfortunately, it turns out heroin's more addictive than morphine.
Yeah, and heroin's used so much now because people get addicted to opiates because they have a surgery or they take their parents. And then I don't know if you know this, but opiates like Vicodin and Percocet really expensive and really hard to find. And so they switch to heroin because it's cheaper, easier to get, hits you instantly, and then they just overdose because it's really easy to overdose on heroin.
It is. I've had that's most of the ODs that I've taken care of were from heroin, not from shit like morphine.
Yeah, I mean, because morphine's not even really that strong, right? It's like Dilaudid and fentanyl and stuff like that's really strong.
Fentanyl is like 200 to 300 times more potent than morphine.
So you just need a little bit.
I have seen people smoke patches that they took off of a patient to
I
get
assume they
high.
were freebasing them.
Ugh. Yeah, you'd peel the fentanyl sticker off of a patient's back, roll it up, and then just burn the latex rubber shit on it, and just
Oh,
try to huff the stuff off of it.
really? That's ineffective. I assume they would like scrape the gel out into like a little like bulb or like crack pipe and like heat the bottom and smoke it.
I assume the smart people would. The people that I worked with and then got accused of it were not very smart.
Oof, that's rough.
That's what I've seen. But I work in a nursing home in Southwest Florida, so who knows?
Oh yeah. Florida's like that's where all those pain clinics were, where people would like go down there and get like a bunch of free painkillers or
Big pill mill area is Florida here. Absolutely. Which most of them are closed now. There's only now it's so controlled here. It's almost harder to get, for the most part, for the patients that really need it.
Yeah, that's the tough thing.
Yeah,
They ruin it, just like the homeless people that are just getting money in for booze. They ruin it for the real homeless people that need the money.
everything is a pendulum. Everyone can get pills. Well, make it so no one can get pills. Like, there's no happy medium. Everything's a one way or the other.
It's deep.
Electrical impotence cures. Doesn't work. I can't believe it's something they wanted to do. Couldn't get your shit hard. They would hook you up around your groin and thigh area and shock the shit out of you to try to improve blood flow.
I know we got boner pills now. It's Viagra, or what is it, sildenafil or whatever.
Sildenafil citrate is Viagra, and then there's Cialis.
Sildenafil.
Yeah. Is that the drawer open and close? Now, that was originally created as a blood pressure medication, and it's still used as one. It's also used for pulmonary hypertension, which is black people are more susceptible to pulmonary hypertension, which means they have an increased pressure in their lungs, which allows them to not breathe as well. So the Viagra is used to open up the vessels and allow better blood and oxygen flow. It's something I never thought I would see or have. It's like a bunch of patients on Viagra for a certain amount of time, and they've been on it for 10 to 15 years because they can't breathe.
Works like a champ. Yeah.
And some of them
I've taken Viagra, and it definitely works. And I can dispel some myths about it if you'd like. It doesn't just give you a rock hard boner for however long you're on it. It just makes your dick work for however long you're on it. Yeah, drug induced ED. Adderall, Celexa, kill both two things. They kills your boner. So they prescribed me Viagra, sildenafil. But yeah, it just makes your dick work. It's kind of nice.
I didn't realize Adderall made it not work.
Adderall, and then Celexa, the like SSRI that I take, also they prescribe that for premature ejaculation. So those things stacked was messing with my whatever. So they prescribed me that too. But as I got used to the Adderall, it doesn't have nearly as much of an effect.
Excellent.
But it does make your production higher, like the amount
your blast
that comes out. Yeah, your blast radius,
super soaker
shot, or whatever you want to call it. And it's cheap. It's like $15, you know.
Now
generics now.
Yeah, now that the patent ran out.
Yep.
So next would be bloodletting, which they actually still do, but not like they used to. They used to remove blood from an area that was infected. Now they use it if you are, like I've had a few patients that have to get consistent, they have to give blood because their hemoglobin production is so high, you end up getting blood clots. So you actually have to remove blood in order to remove some cells.
We have a scientific reason for it now.
Yeah, now it's truly...
So maybe back in the day, like it worked a couple of times. Like they were letting blood and somebody actually got better.
Right, so back then you'd have like an infection, like, oh, this foot is red and swollen, you had to get your blood taken out. It just because they had a major infection and they needed real surgery and an operation, so they just took the blood out. Because back then you didn't believe blood flowed through your entire body. It was all localized.
Ooh.
Oh, his foot blood's bad. We got to drain the blood, the foot blood. Didn't work that well. They didn't realize circulation was the thing. The other thing, which got huge in the early 1900s, lobotomies, which is fucking fascinating to me. It's fascinating to the wife. I've listened to so many podcasts about it. The idea originally was to drill into the top of the skull and mess with just jingle up your brain a little bit.
I thought it was to relieve pressure.
Lobotomies are to treat bad behavior.
Okay. Like one flew over the cuckoo's nest type thing.
That kind of crazy. Yeah. John Kennedy's sister had to get a lobotomy. They done fucked it up because they did that surgery on her when lobotomies weren't even good anymore. They had realized lobotomies don't work. But good old Jack Kennedy had it done anyway, and she was like 14. They drilled a little too far with the ice pick, turned her into an infant. She was
A savant.
the mental acuity of a 2-year-old for the rest of her life. Incontinent of stool, urine, just all sorts of fucked up the rest of her
You
life.
want to be continent of stool for sure.
Generally, I don't like shit up my back.
It's hard to date.
So they created the procedure in the late 1800s, and then they perfected it when they realized they could use an ice pick to drill on the inside of your eye by the bridge of your nose.
Oh, come on, bro. Don't. Oh, come on.
Shake it up a little bit.
Come on, bro.
It didn't work. It's just one of the. I'll do one without you because Nicole's gonna want to be in on that one because she thought it was fascinating when I talked about
gross episode.
Ice pick and a hammer.
About me. I got one gross thing. I was a wrestler in high school. You're familiar with cauliflower ear? You know?
Yeah, popping the blood vessels in the ear, no place for it to go.
Yeah, it's like it builds up scar tissue or whatever.
Yeah, you can if you don't take care of it turns into scar tissue, but you smash it, you pop all the blood vessels, you can drain it and get it normal shaped.
Yeah, so my ear got all fat, filled with whatever, pus or whatever. Oh god. So I would take my friend's mom's diabetes needles and drain it. I did eventually get surgery on it, and yeah, it's all good now. It's like rock solid in the middle. Like,
I didn't know that about you.
Like a half inch or whatever.
One thing's rock solid about you.
My nipples.
Another one, trympaning, which works similarly to a mixture.
Wait, is that that's the brain drilling thing, right?
Yeah, it works similarly to bloodletting and lobotomies mixed together. Except trympaning in the earliest form was meant to let bad spirits out. So it's drilling burr holes when you have a concussion.
Oh man, I remember seeing a documentary about this when I was like really young. This is super gross. They drill into your like head to release the pressure.
That's dirt. Oh, I just watched a documentary like 9 months ago. People still do it.
There's no way our listener is still listening at this point.
Yeah, they're probably gross out. Moving on. Ear candles. Another thing making a fucking comeback.
Oh, did you say beer candles or ear candles?
Ear candles. You put a long candle in your ear. You burn off some of the wax on top.
What? No, I thought you were gonna take the wax out and make it into a candle. You put a wick into your ear. You like your head's dynamite.
Like an actual candle that's already got the wick in it. You put the light to the top. You let the hot wax come down into your ear, and then you remove it. It doesn't really work because it's not long and it doesn't go deep enough. People used to just burn down the fucking house, not know what the fuck they were doing. It was meant to just.
I feel like those people deserved it if they're putting a wick into their ear. It's whatever.
It was really just meant to clear the wax and everything like that, but it just didn't work.
Well, I have something relevant for this. If a bug ever flies into your ear, and this can happen because it happened to my dad.
Happened to me.
Really? Yes. This is like a traumatic experience, but pour olive oil into your ear and it'll drown the bug, and then go to the hospital and they'll remove it.
You can just squirt saline in your ear. I had to go to
Yeah,
the
if
ER.
you have saline on hand, like you do or whatever.
I was in a
We're
19.
Italian. We have olive oil in our saline bottles.
I was in a maroon 1992 Ford Mustang hatchback, playing around with my buddy.
5.0.
It was actually. It was
Ooh.
an LX 5.0. It was a base model with a V8 engine.
Did you put the flat top down so your hair can blow?
I wasn't even old enough to even fucking know anything about it.
It's from Vanilla Ice. Whatever. Go
Yeah, word to your mother.
on.
I was messing with the visor, and I got a bug flew into my face, and it freaked me out. Not 45 minutes later, you can feel the bug flapping,
Dude, that sounds terrible. I can't even.
but you
My
can't
dad
see
was
it.
freaking out.
Yeah, I couldn't see it. My family couldn't see it, and it just scared the ever loving shit out of me because I didn't know what it was. I didn't know what it was. I didn't see the bug. It flew at my face, and then it was gone. And
Yeah, I
then
assume it feels like it's like beating your brain or something.
it feels like it's inside your head, like you're a schizophrenic. Like it's real. You guys can't hear that. It's so loud. I ended
But
up
if you
having
are schizophrenic, it's not real.
it's not a real moth. I
But
had to go to
oh
the ER.
shit, could be.
It was so the ER doctor had a syringe with a super long needle on it to get it a little bit deeper into my ear to squirt the saline.
Oh, so you didn't do it yourself? You
No,
just went to the doctor with it
dude,
beaten in there the whole time?
dude, I was 10 years old.
Oh wow.
Yeah, this is not an adult thing.
Yeah, my dad was freaking out, and I looked it up online real quick, saw the olive oil thing, and then poured it in there, and it stopped it. But then we went to the doctor, and they pulled it out.
Yeah, it worked. It was, but it was. It's one thing I forget that it's one of those things that I went to the ER for because it
Oh
was
yeah.
nothing.
Well, I've got one of those. I don't ever forget though. I was at Boy Scout camp, and I started feeling extreme pain in my stomach, and they thought, "Oh my God, he has appendicitis," and I was screaming in pain. And
Mm-hmm.
they called the ambulance, and they took me to the hospital, and my appendix burst. No, it didn't. I was severely constipated because I hadn't pooped in like 8 days because the toilet there is a friggin' tin can on a hole. And yeah, they gave me a suppository and it took a huge poop and I felt much better. And they gave me Dilaudid, which was lovely. But yeah, so make sure you poop every couple of days at least.
At the worst. And the last but not least is something that is not common or really gaining any tread, and that was psychic surgery, which is just the worst. Like I can't. It
What's it
couldn't have
called?
a psychic surgery. It couldn't have been something that was ever popular here, because it was surgery with a psychic, where they would cut you open with your bare fucking hands and touch the organs that were affected.
Oh, like an Indiana Jones where he just like pulls the heart out.
Except they would keep it in there and they would trace around the heart like it's a magic 8 ball to try to fix it psychically.
Oh man. When girls tell me they're into astrology, I'm gonna be like, all right, let's go.
Let's
I'm gonna
do this
trace your
psychic
heart
surgery.
organ.
Yeah, I'm gonna grab your heart with my bare hands and make you love me.
Give it a little squeeze.
Hoorah. All right,
Wrap it up.
I think we did it. This has been episode 23 of the greatest fucking podcast you've ever heard. This is the beautiful OnCallPod banner behind me, brought to you by the wonderful folks at Concepts AD. There's my wonderful flexed buddy over there, lol.
I'm not flexing. This is just me normal.
Ugh. What do you got for me? Say
I
good
can
evening.
bounce my pecs.
Say what do you got for a good evening for me, amigo?
Oh, okay, yeah. Check out if you're interested in starting your own podcast. Check out buildacast.com. There's resources, guides, gear, and tutorials. Check it out. Yeah, that's all. That's all I got.
Link in the show notes. This has been
Ayo.
the On Call Podcast. Hit me up on Twitter at OnCallPod, OnCallPod.com. Search me on Facebook, OnCallPod. Soon there shall be a link on the Concepts AD website, hopefully mobilized soon for cell phones. And there'll be a link for me there. You'll see some more gear for Concepts AD, whether it be banners like this or headbands, face masks, shirts.
Yeah, you can get a face mask for your business. I mean, come on, that's huge advertisement. People want to check out what face mask people are rocking nowadays. Totally untapped market space right there.
Right? Check out my Twitter. You can see the things that they're willing to design for me, whether it be a barbecue sauce label, a flamethrower, anything that you want. Anyway, y'all have a good night. I'm off to cuddle the wife and make up for the fact that I rearranged the entire room while she was getting groceries. Have a good night, y'all. Deuce is
All right,